Breast cancer is the most common form of cancer affecting women. Now, historically, patients have been told to rest through their treatment. Now, this includes going through their chemotherapy or their radiation. However, research now supports the opposite. We now understand that exercising through your forms of treatment is going to give you the best outcome post-treatment. Exercise helps to reduce cancer treatment symptoms. It helps to increase your tolerance to these aggressive forms of treatment. It reduces cancer-related fatigue, improves bone mineral density. It helps to boost your immune system and improve your well-being overall. Research now strongly suggests that exercise should be prescribed alongside those main forms of treatment, including your radiation therapy and your chemotherapy. Exercise should be considered a top priority when you're going through your cancer treatment. Now, exercise professionals can prescribe exercise just as doctors can prescribe medication. It needs to be specific to the person. There are many factors to consider when prescribing exercise to the individual. Now, this includes any medication they might be taking, their current abilities and energy levels, the current treatment they're undergoing, and whether any surgery has been performed. It also needs to take into account the goals of the patient and what they're hoping to achieve and their expectations. Now, every little bit of exercise helps when going through your cancer treatment. Even if you can only manage a walk to your letterbox and back, this is going to have a better impact on your health than doing nothing. Now, obviously your exercise is going to be dictated by your symptoms on the day, but it's really important that you stay as physically active as possible while going through your treatment. We know that exercise has a really strong and positive impact on your bone mineral density, your fatigue and energy levels, your mental well-being, and your immune system. So it's really important to keep active while you're going through your treatment and even after you've finished your treatment to make sure you have better health outcomes into the years to come. Now, when you're starting exercise, make sure that you talk to your doctor or your oncologist to make sure that they're able to refer you to an appropriate exercise physiologist or exercise professional who has a good understanding of the treatment that you're going through, the medication that you're on, and what you're hoping to achieve. Now, when you start exercising, it's important that your program has a combination of resistance training, aerobic training, and flexibility or mobility training. Now, resistance training is really important because it helps to build your bones up nice and strong. It also helps to make sure that your muscles are working nicely and you're not having any sort of sarcopenia or muscle loss, muscle wastage through your treatment. Aerobic training is really important because it really focuses on your heart and your lungs, making sure that your cardiovascular system is working nicely. Now, mobility and flexibility training is really important, especially if you've had surgery, because surgery can impact on your range of motion, and we need to slowly increase that back to any normal ranges that you had pre-surgery or pre-treatment as best we can. It's really important that you talk to your doctor before you start exercising, just in case there are any considerations around you starting exercise, and to make sure that the appropriate referral can be made. Remember, even a little bit of exercise is better than no exercise, and overall, regular exercise is going to predict a better health outcome for you while you're going through your treatment.